Thank you very, very much. I am deeply honored and humbled that the Gay and Lesbian Medical Association, an organization that is about to celebrate its 25th anniversary of service to all in need of health care, but especially to those who are among its most vulnerable, is honoring me with the GLMA Achievement Award. It is a pleasure to congratulate you on your own achievement, and I bring the appreciation and good wishes for continued success from the Black and other minority caucuses. As you who lead know, I cannot take full credit for all of the work that I am being recognized for today, because I do not do any of this alone. And so I accept it on behalf of my staff, my colleagues in the CBC, those in the other minority caucuses, and all of the organizations, including GLMA, who have made every success possible. Throughout my tenure in Congress, I have enjoyed the great relationship that my office has had with GLMA, and I must really take this time to acknowledge Joel Ginsberg, the Executive Director, for his tireless efforts advocating for quality health care for LGBT individuals and healthcare professionals, and for educating congressional offices and members about the health disparities that affect the health outcomes, well-being, and health care of LGBT populations. Because of your leadership, Mr. Ginsberg, and the great work of GLMA in this quarter of a century, there have been successes associated with this determined, savvy, and dedicated organization. Because of GLMA, the federal government now includes LGBT populations as part of Healthy People 2010. It is you who played a key role in developing the Healthy People 2010 LGBT Companion Document, which is a great resource in my office and that of many of my colleagues. GLMA has made an important difference on Capitol Hill. Mr. Ginsberg, again, thank you for your leadership, and thank you, GLMA, for your contributions to making this a better country. As a physician and chair of the Congressional Black Caucus Health Brain Trust, I, like you, am deeply committed to reducing and eventually eliminating health disparities. We have all heard the numbers and all know about the factors that contribute to them. We also know from myriad research studies that healthcare disparities detrimentally affect the health outcomes and the quality of life of so many of the diverse groups that are the strength and fabric of this country. Health disparities affect racial and ethnic minorities, they affect rural Americans, and they affect people with disabilities. They also affect LGBT populations, a fact that an increasing number of people interested in reducing health disparities are beginning to embrace and champion. As we move forward in our efforts to reduce and ultimately eliminate health disparities, it is important that we do so in a manner that really addresses it as it affects every affected group and at its root causes. This means that we will have to introduce and support legislation that strategically eliminates the inequities upon which healthcare disparities are created. In the days that have followed Hurricane Katrina, I think that America has learned a great lesson. At least I hope so. It is a lesson that all of us here already know, and it is a lesson that far too many Americans have avoided facing. It is that this is not one America. It is that poverty exists and is pervasive, that discrimination exists, and that many are left out and left behind every day. And while the country may have been awakened to much of what African Americans face and face every day, the challenges faced by the gay, lesbian, bisexual, and transgender community, whose important needs were largely ignored, were hardly seen or acknowledged. Some were sent places where their status was not protected, and there were no stories about these families who were torn apart and faced many barriers to services that everyone else could almost take for granted. The health disparities that we see today are largely the result of the economic, cultural, social, and environmental inequities that have and continue to exist in this country. So as my colleagues and I move forward, and as we work to ensure that the Gulf is rebuilt and renovated, we must also ensure that our country moves forward, applying the lessons we learned from this catastrophe, that we must build back a stronger New Orleans and Mississippi, not restore the systematic weaknesses, inequities, and discriminations that fuel the dire poverty of which we got only a glimpse. And we must build a stronger, fairer, more just healthcare system. In the reconstruction process, we must ensure that health disparities are eliminated for everyone. Many ask, what are we in the Health Brain Trust going to do now? For us, the agenda remains the same. We can only hope that the ground into which we sow is more fertile than before. We have reintroduced the Healthcare Equality and Accountability Act of 2005, and we will continue with our efforts to improve data collection, to diversify the workforce, to promote capacity building, to establish health empowerment zones, to support health care that is culturally and linguistically sensitive and appropriate, and that includes ensuring that the healthcare system is respectful and appropriate to LGBT populations. I am committed to achieving this goal, and I know that I cannot do it alone. We will need your help, and we look forward to working with GLMA and other trailblazers who are interested in pushing the envelope and ensuring that all Americans, regardless of racial or ethnic background, regardless of geographic location, regardless of sexual preference or identity, have equitable access to health care that is appropriate, respectful, and adequate and reliable. Again, congratulations on this milestone. Thank you for the work that you do every day and the contributions of these first 25 years. Thank you very, very much for honoring me with the GLMA Achievement Award. Let us together use this opportunity, born out of tragedy, to make us finally one America in every respect.